Welcome to Anatomy and Physiology for the Easily Distracted. Grab your snacks. Today we're making the heart less mysterious than your last group chat. We're about to speedrun the heart, blood vessels, lungs, and kidneys, like a medical obstacle course, but with fewer pulled hamstrings. Think of this as the Great British Bake Off, but instead of cakes, we're assembling the ultimate human heart, and yes, there will be layers. Aprons on. Let's slice into the heart. Figuratively, please. The heart has three layers: the endocardium, myocardium, and epicardium. Imagine a triple-decker sandwich, just less tasty. Endocardium is the inner bread, keeps things neat and tidy. Myocardium is the protein-packed filling, does all the heavy lifting. Epicardium is the top bun, protects everything and looks good doing it. The whole thing is wrapped in a pericardium, like a Ziploc bag for your heart. Too much fluid? That's a soggy sandwich, medically known as pericardial effusion. If the bag squeezes too tight, you get cardiac tamponade. Imagine a bear hug from a sumo wrestler. Not recommended. Ready for the blood flow wrap? Drop the beat. Blood enters the right atrium, slides through the tricuspid, dives to the right ventricle, bounces to the lungs, grabs oxygen, then sprints back to the left atrium, through the mitral, into the left ventricle, and out the aorta. Victory lap. Lungs are the pit stop. Oxygen in, carbon dioxide out. Quick tire change, back on the road. In the body, it's the opposite. Oxygen hops off, carbon dioxide jumps on. Teamwork. Pop quiz. In your body's capillaries, does oxygen stay or go? The heart's bouncers. AV valves, tricuspid and mitral. No ticket, no entry. Semilunar valves, pulmonary and aortic. They're the exit doors. Don't let the blood hit you on the way out. S1 is the lub. AV valves slam shut. S2 is the dub. Semilunars close. It's the original beat drop. Translation: your heart is a squeaky door at a dance party. Creak, creak all day long. The heart's electrical system. SA node to AV node to bundle of His to branches to Purkinje fibers. It's like a relay race, but with more electricity and less spandex. Parasympathetic nerves are the chill playlist. Slows your heart. Sympathetic nerves? That's your double espresso. Heart races. EKG time. P-wave. Atria flex their muscles. QRS. Ventricles show off. Big flex. T-wave. Everyone chills, Netflix, and relax. Rapid-fire disorders. Heart attack? That's a clogged artery. Your heart's version of 404. Blood not found. AFib and VFib. The heart's wild dance party. No rhythm, just chaos. Bradycardia. Heart's on vacation. Slow and steady. Tachycardia. Heart's had too much energy drink. Zoom. Pop quiz. What happens if your heart valves quit their job? Answer: blood backflow. Not ideal unless you're a salmon. Imagine arteries as speedy highways, always moving fast, never stuck in traffic, and occasionally changing their exit signs just to mess with you. From subclavian to axillary to brachial to radial and ulnar, these vessels are the ultimate road trip, with more name changes than a pop star. Down south, it's iliac to femoral to tibial to dorsalis pedis, like a GPS for your legs, but with fewer wrong turns. In the neck, it's carotid artery and jugular vein. Think of them as the express lanes for brain fuel and trash removal. Arteries are the over-caffeinated delivery drivers. High pressure, always on time, and never taking the scenic route. Veins? They're the lazy rivers of the body, relaxed, full of valves, and perfect for a slow float back to the heart. Capillaries are the farmers' markets, tiny stalls where oxygen and nutrients swap hands in the world's smallest deals. The brain's circle of Willis is like a roundabout. If one road's blocked, there's always a detour for your neurons. The liver's hepatic portal vein is the TSA of your digestive system, screening all incoming food before it hits the bloodstream. Fetal circulation comes with secret shortcuts: foramen ovale and ductus arteriosus, the baby's cheat codes for bypassing the lungs. Pop quiz. Which vessel is the liver's personal bouncer, checking IDs at the door? Answer: the hepatic portal vein. No fake IDs allowed. Imagine your airways as a superhighway. Air zooms in through the nose, takes a pit stop at the pharynx, cruises past the larynx toll booth, speeds down the trachea expressway, splits at the bronchi roundabout, and finally parks in the alveoli cul-de-sac. The alveoli. Think of them as tiny marshmallow pillows where oxygen and carbon dioxide swap stories. Comfy, squishy, and essential for a good night's breath. Surfactant is like the non-stick spray for your lungs. No sticking, no squeaking, just smooth breathing. Without it, your alveoli would cling together like clingy X's. When your sympathetic system kicks in, your bronchioles open up like automatic doors at a mall, ready for action, more air, and maybe a dramatic entrance. Parasympathetic mode. The doors gently close, lights dim, and your lungs say, let's chill and binge-watch some oxygen. Chat check. What's the name of the no-stick magic that keeps your alveoli from gluing shut? Answer, surfactant. The unsung hero of easy breathing. Air always moves from high pressure to low pressure, like students rushing out of class when the bell rings. Inhale, your chest expands, pressure drops, and air rushes in like it's Black Friday at the mall. Exhale, chest relaxes, pressure rises, and air leaves, like the last guest at a party. The diaphragm is your breathing MVP. Think of it as the dance floor that drops when the music starts. Intercostals? Backup dancers always in sync. The medulla oblongata is your brain's air traffic controller, constantly monitoring CO2 and making sure you don't forget to breathe during Netflix marathons. Too much CO2? Your body hits the panic button. Hyperventilate like you just saw your exam grade. Too little CO2? Your body chills out. Hypoventilate like you're napping in class. Imagine your urinary system as a water slide park. Kidneys are the ticket booth, ureters are the twisty slides, bladder is the splash pool, and urethra is the exit gate. Parasympathetic nerves yell, everybody out of the pool, while sympathetic nerves whisper, hold it, the lifeguard's watching. ADH is your body's water-saving app. Turn it on, and you keep every drop like a camel with a smartphone. Aldosterone is the salt manager. When it's in charge, sodium gets VIP access, and water follows like a groupie. The nephron is a wild obstacle course. Start at Bowman's capsule, dash through the PCT, loop-de-loop, DCT, and finish at the collecting duct. PCT is the overachiever, rescues all the glucose like a teacher collecting every single homework. Pop quiz. Which nephron segment is the glucose superhero? Answer, the PCT, obviously. Give it a cape, lightning round. Which heart sound means AV valves just slammed shut? S1. Semilunars? S2. Electrical relay race. SA node to AV node to his to branches to Purkinje. Go team go. ADH is the water hoarder. Aldosterone is the salt collector. Together they're the body's weirdest roommates. PCT grabs glucose like it's Black Friday at the kidney mall. Alveoli need surfactant like pancakes need syrup. No sticking, just smooth moves. Final challenge, exit ticket. Name all 4 heart valves. Bonus points if you sing it. Where does oxygen hop on the bloodstream train? Pulmonary or systemic capillaries? Which hormone is the collecting duct's bouncer for water? Hint, it's not Gatorade. Metabolic alkalosis. Should you breathe like a marathon runner or a napping cat? You made it. If you can explain this to your pet goldfish, you're ready for the exam. And maybe a career in stand-up science. Go crush that test and remember, kidneys love you, and so does glucose reabsorption. See you next time for more science shenanigans.